Hi everyone, today we're going to be talking about how to get rid of your PCOS belly by taking actionable steps to get you to your goal. I'm Dr. Kim Somerville, medical doctor, clinical nutritionist, and this is Simple Summer Naturals. Let's get into it. The first thing I want to talk about is that PCOS and having a PCOS belly is not your fault. It is not a moral failing. It is a disorder that causes you to have more cravings, then leading you to eat more high-calorie foods, and it makes you actually store fat more than usual. So feel confident and feel comfortable in knowing that you can take supplements or medications that can help you reduce your cravings, reduce your insulin resistance, and then that can help to reduce your symptoms of PCOS, like having a PCOS belly. It is not your fault. You can do it, and it is okay to get help where you can get it. I have a few videos about PCOS supplements and medications, and if you need help figuring out which one may be right for you, you can go ahead and check them out right here. What is the PCOS belly? It really can occur with anyone with PCOS, whether you have a normal BMI, overweight or obese, or even underweight BMI. What happens is that with people with PCOS, we find that they have something called insulin resistance, where the body's cells don't respond to insulin the way it should. So what then happens is that the more insulin resistant somebody is the more the person is going to be storing fat. And the area in which they store fat the most is in the abdomen. You have some fat that is around your organs like the liver, the spleen, the kidneys, the colon, and the pancreas. And this is called visceral fat. The more visceral fat you have is the more insulin resistant you become. So it sort of looks like a cycle. Insulin resistance, abdominal fat. More abdominal fat, insulin resistance. So we want to go somewhere in the middle to break that cycle and reduce your PCOS belly. The first step in lowering your PCOS belly is knowing your measurements. We have to know where we're starting from in order to know when we get to the goal. So what we're going to do is take your tape measure. We're going to take that tape measure, and usually the typical thing is to just measure around your navel. But in order to be the most accurate, what you're going to do is feel for the lowest part of your ribs and then feel for the highest part of your hips. In between that length, right in the middle of that, is where we'll be considering your waist. So at that point, you're going to then take your tape measure and bring it all the way around your abdomen. That is the measurement of your waist. Now, in order to know if your waist measurement is somehow giving you a higher risk of developing complications, we use two measurements for that. We first think about our waist to height ratio. So you have the measurement for your waist, and now you're going to take your height. And we're going to be then using the waist divided by height in terms of its inches. If you have a waist to height ratio that is greater than 0.5, then that means that you're at higher risk of having insulin resistance, as well as having a higher amount of androgens or testosterones, those hormones that make us have a little bit more hair growth, more acne, and sometimes thinning of the hair on our scalp. The second ratio that we are interested in is the waist to hip ratio. So you have your waist measurement, now do your hip measurement. This one is a little bit easier, where you just take your tape measure, bring it around your buttocks all the way around your hips, and find the largest measurement. That would be considered your hip measurement. After that, we are going to then divide the waist measurement by the hip measurement. And there you're going to have your waist to hip ratio. Now, if this ratio is greater than 0.85, it really means that you are at a higher risk of developing type 2 diabetes, as well as cardiovascular disease or heart disease in the future. Now, of course, we don't want that, so we're going to really think of this as having another reason as to why we want to reduce our PCOS belly in order to maintain our health in the long run. Now that we have our waist to height ratio and your waist to hip ratio, we're now going to think about our total daily energy expenditure. It's a long term, but really all that it means is that we're trying to find out how much energy or how many calories do you burn for the day. This is important because reducing your belly does not really just mean that we're going to work on your belly, but we have to work on the entire body in order to see the benefits that we're looking for. So you're going to go online and type in TDEE calculator. It's going to give you a lot of different options, but choose the best one for you, and then it's going to ask you about your measurements. So it's going to ask you about your age, your gender, your height, your weight, your activity level throughout the week, as well as your body fat. But you don't really need body fat if you don't have it. All of these measurements is going to be able to give you an estimate of how many calories you're burning. So for example, when you do this calculation, you find that you burn about 2,000 calories per day. In order to lose fat or lose some body weight that is associated with your abdomen, you're going to want to start eating about 250 to 500 calories less than what you see in the calculation. So if I got 2,000 calories, I would then ensure that what I'm eating every day is about 1,500 to about 1,750 calories in order to burn fat throughout the week. Usually what that is, or that ends up to be, is about 1 to 2 pounds of weight loss per week. This is going to translate to a reduction in your abdomen, and that is what we want. Now that you know the amount of calories you should be having on a daily basis, how are you going to achieve this? How will you actually lower your calories in order to lower your PCOS belly? First thing that you want to do is reduce your simple sugars. Now, having carbohydrates is necessary. Persons always want to just get rid of carbs altogether, but carbs are important for energy. But the simple sugars, like those in sodas, juices, pastries, cookies, all of these may not be the best for you because with PCOS, you tend to not use these sugars well, and they end up being stored as fat and actually help to increase your cravings in the long run. So I usually tell my clients the first thing you want to do is start to switch these out to alternatives in order to see a reduction in your calories and a possible weight loss in the long run. So you're going to want to switch sodas to sometimes sparkling water, juices to things like coconut water, pastries, cookies to things like nuts or fruits, but in smaller portions. And sometimes the thing about it is you don't have to get rid of these things altogether, but reduce the portion sizes considerably. Your portion size is going to be dependent on your age, your height, your weight, your activity level. So it's really very specific to you and only you. If you need help, I am a nutritionist, as I said. So if you want to click the link in my description to see my appointments, we can work on a one-on-one basis to find out the portions that are right for you. After reducing your simple sugars, another thing you can do is add more fiber to your diet. More fiber helps to improve your bowel movements, reduce your bloating, and reduce your insulin resistance. Remember in the first part of the video, I talked about more insulin resistance means more abdominal fat. So if fiber can reduce that insulin resistance, we know that it can reduce the abdominal fat as well. So some things that have fiber include sweet potatoes, pak choy, beans, lentils, chia seeds, flax seeds. These things you can easily add to your diet, and it really will make a world of a difference when it comes to your abdominal health. If you want a little bit more comprehensive list on different types of foods that have fiber, you can check out the Ideal Jamaican Meal Guide, which is an ebook on my website, and you can check it in the link in my bio as well. This is my last diet tip because it's one of those things that all the health influencers and nutrition gurus are talking about right now, but it is adding more protein. Protein is one of those really good building blocks for health because it helps to reduce your cravings, it helps to increase your fullness, and it also helps to improve your muscle growth. All of these things are important when we're trying to reduce insulin resistance and reduce our PCOS belly. Protein sources are pretty simple to come by, I would think, but when we're trying to reduce our weight, we want to make sure that we're getting lean sources of protein. And that really just means protein sources that have less fat. So that can be chicken or chicken breast, that can be tuna, sardine, mackerel, salmon, snapper, that then can be turkey slices. It can also be tofu or veggie chunks for persons who are more on the vegetarian or vegan side. It can also be beans and nuts, but honestly, beans and nuts tends to have more carbohydrates and fiber than they do protein. So just be wary when it comes to that. You can add your beans in, but think of it more for fiber and carbs purposes than really protein. So if you're gonna have protein, one thing I don't really hear people talking about a lot is that if you're increasing your protein, you have to also increase your exercise, because protein is also a source of energy. So the more protein you have, if you are not burning it or burning it off, then it also can be stored as fat. So there's more exercise that needs to be added, and there's also more water that needs to be drank. The reason for this is that if you are having a lot of protein, you need something to help move that protein throughout your gut, because it will cause constipation. Don't say I never warned you. So remember that the amount of protein you should have, it's not going to be the same for everyone. So if you want me to do a separate video on how much protein that you need, let me know and I'll do just that. Now the other tip, as I spoke about before, is exercise. Usually with exercise, we don't have any one specific type that is found in studies to be effective. It's just noted that the time or the amount of effort put into exercise makes the difference. So usually what's recommended is about 150 to 300 minutes of moderate exercise per week, or 75 to 150 minutes of vigorous exercise per week. And the intensity really just means how much of your heart rate is increased, and that will also be determined by you as well. Usually, if you can wear a smartwatch to tell you how many calories you're burning or the level of your increase of heart rate when you're exercising, will be able to determine if this was a moderate exercise or vigorous exercise for you. Generally with clients, even though we're not specifying the types of exercise, we find that strength training, which includes using your body weight for like calisthenics or using resistance bands or weights, tends to help improve muscular strength and growth, as well as increase the amount of calories you're burning per exercise. Of course, walking, running, swimming, and aerobics are important as well, but we're considering what will really help to reduce your PCOS belly. And strength training and aerobics are something that you can definitely add in. Just remember to ensure that the intensity is what you're getting, and you're getting enough per week. When they actually did the studies and they used those amount of minutes of the intensity of exercise, they found that persons with PCOS had about a 1 to 4 centimeter reduction in their waist, and that is about an inch or more reduced when they exercise consistently for a month or more. The last thing that I would want to discuss, even though I didn't find many studies about it, is that you want to try and reduce your stress level. The more that we are stressed is the more that we're going to producing stress hormones like cortisol, and the higher cortisol is the worse that your insulin resistance is going to become. And of course, what did I say before? More insulin resistance means a higher amount of abdominal fat, okay? So in any way that you can to reduce your stress levels, we want to try that. So if it is finding stress-free exercises, coloring, reading, going out, walking, whatever you can do consistently to reduce your stress, it's going to be the best for you and your abdomen. If you are in a constant stress filled environment, try talking to a therapist or a counselor and see what coping mechanisms they can recommend for you specifically in order to reach your goal. And of course, remember, the more stress is the more cravings you're going to have as well. So it really is a win-win if you're able to find stress-free activities to get you closer to your goal. Now, let's just recap on all that we said. In order to reduce your PCOS belly, we first are going to know our measurements. So that's our waist to height ratio, our waist to hip ratio, and our total daily energy expenditure. Once you know all of that, we're then going to be able to manage our diet, which is reducing simple carbohydrates, increasing your fiber, and increasing your protein. And for the exercise portion, whatever exercise you choose to do, ensure that it is the proper intensity that you want and the proper amount of minutes that you're putting in to get you to your goal. And of course, help manage your stress. You can do it. Just try one step at a time. And if you need one-on-one support, contact me and we can work together. I hope you have a wonderful day today. I am Dr. Kimberly Somerville for Simple Summer Naturals. Take care.